We should do mic check.
Okay, mic check, mic check.
Test.
So we have like a little bit footage for the bloopers.
Got it.
So,
Okay.
yes. So I'm going to fix my hair.
Always right.
fix
Gotta
your
adjust my
hair,
stupid
yes.
scrub cap, you know. and
Perfect.
All the good
So
stuff.
I noticed that you guys have like totally like different styles, different
Different types of scrub
designs.
caps. Yeah.
It's a surgeon thing, right?
Yeah. We just like
Okay.
it for fun. It's a little way to show your personality. I like my sports team. So this is actually just a tooth one that someone gave me, but I've got like a St. Louis Cardinals one, a Kansas City Chiefs one, St. Louis Blues one. So it's a way for me to express myself, you know.
Since you're wearing this boring
Since I'm just wearing, you know, boring black scrubs, right? It's not professional to come in here in a Cardinals jersey. So at least I can get away with it with my scrub hat.
Yeah, that was a fun fact.
Fun fact.
Perfect. You met Dr. G. Now you meet Dr. B.
How's it going, everybody? I'm Dr. B.
Dr. B partnered with Dr. G. So now it's an amazing team of two surgeons, right?
Yeah, it's been great.
And you give people a new life, new smile.
That's what we try to do, you know. I met Dr. G kind of through dental friends. So dental community is a very small community, obviously. And after my residency, right, like the first job out of residency is you got to go find a job, right? And so it's the kind of the one thing they don't really teach you about in school is how to really go about this business, right? You sort of graduate and you're just so focused on, oh, I learned how to do implants. I learned how to do gum grafting. Like my life's going to be great. And then you graduate and you're like, I got to go find a job, right? And so just kind of through dental community, dental friends, I kind of got hooked up with Dr. G. And, you know, for me, he's been a great mentor for me so far. And it's just kind of fun being able to, you know, be in office with another periodontist, one that has so much experience, and being able to kind of collaborate on cases. You know, I could just sort of share some of the new age stuff that I've sort of picked up in residency, right? He gets to share with me a lot of the sage wisdom of stuff he's done and seen, and it makes for really, really nice partnership with us.
Awesome. So let's stay on the subject. From the perspective of the patient, they're looking for the right provider, but you as a professional, you also look for a perfect fit as a partnership, right? I want to do this quality job, so I need this perfect surgeon or perfect someone who can teach me stuff, or we can work together on the same level of quality, right?
Totally. It's hard. I mean, I think it's something you don't really realize, but finding sort of the right mentor, finding someone that's willing to sort of bring you into their practice is hard. It's not easy. You know, most dentists, especially early on in their career, go through multiple different offices. I mean, I know Dr. G was, I think at one point covering 15 different general dentist offices before he kind of settled in with ImplantWIDE. And so a lot of it is there's no rule book, right? And so I'm here a couple days a week, and then I actually work with one of my friends that's a general dentist, kind of doing all the surgeries in his office, kind of what Dr. G did a little bit in his early days. And when I started working here, you know, it was kind of funny. So I kind of came in for my first day, you know, sort of did a working interview, just kind of seeing how I interacted. And Dr. G is like, hey, you seem like a great fit, but you know, I'll tell you the one thing about ImplantWIDE is it sort of spits out the people that don't belong, right? And so we're about, you know, 15, 16 months in, and I haven't been spit out yet. So I'm assuming that so far it's been a pretty good fit.
Pretty good fit. Did you know that this position, this partnership will include you being a social media star?
I did not. No, I think it's something I've grown into. I think getting in front of a camera is kind of always awkward, especially for like a serious kind of dental professional. And so I think it just sort of morphed into me kind of getting more comfortable. But a fun fact about social media stuff is that my two brothers own a social media company, basically. So all they do is they sort of manage influencers and kind of brand ambassador development. So I get a lot of critiques on my videos kind of firsthand from people in the industry. So it's always fun at family dinners.
And a good critic?
It depends. You know, they say you probably should keep doing your day job, but they will say that I have improved kind of over the last year of doing this. So, you know, I'll take it. It's a nice compliment from them.
We think dentists and we think everybody do the same thing, but they don't. And you specialize in implants. How did you choose this road?
It's a good question. For me, I think it really came into sort of the specialist kind of route that we went. And so I think the most important thing to understand about dentistry as a whole that's very different than medicine is that from a legality kind of perspective, right? When you graduate your 4 years of dental school, technically you're allowed to do everything that a specialist can do. So I think that's kind of one of the most important questions from a patient perspective to ask is really what kind of training does your dentist and or specialist have? So technically, Dr. G and myself are both board certified periodontists, right? Which means that we went through 4 years of dental school and then did a 3-year residency that focused on the treatment of periodontal disease, gum grafting, bone grafting, and also implants. And so I think part of kind of where this goes is you focus on implants because people like to talk about that more. But we also specialize in a lot of different other areas of dentistry. So I think it's important, from a patient to really kind of know where their dentist came from, what kind of training, and know that, not all implant specialists are alike. And technically there is no such thing as an implantologist, right? So if you see an implantologist on someone's website, it's kind of a lie. It's a made up term, right? There is no degree that you get by being an implantologist, right? So it's more the fact that since Dr. and I are board certified periodontists, right, we've had 3 years of surgical training, sedation training, in ways that really make us kind of the best geared people to be able to place implants, us and oral surgeons for sure. But there's no such thing as like an implantologist. So it's kind of a misnomer and a little bit of marketing that patients really need to kind of watch out for.
Good to know. What are the most common mistakes people do after they getting their new smile?
So for me, the way I go about these at the initial consult is I have a kind of a serious conversation about the difference between implants and teeth, right? And so the analogy I always use with patients is that to me, implants are a replacement for missing teeth, broken down teeth, smiles that cannot be saved. As a periodontist, though, our core treatment is trying to save teeth. And so I'm of the opinion that I would never try and sacrifice a healthy, savable tooth for an implant. And so it's important to know that, implants are a great replacement option. They function like natural teeth. They really allow you to give you the best aesthetics, function. You can kind of forget about that you have this stuff in your mouth, but they're not this magic bullet that just fixes all your dental problems, right? And so if a patient has severe decay, didn't take care of their mouth, periodontal disease, right? Implants are not this magic bullet that's just going to make all those problems, not important. So, patients that have implants, even really need to be more diligent about keeping everything clean, following up with maintenance, yearly checkups, yearly x-rays. Because just like their teeth got into bad shape, implants can have problems, right? Implants can lose bone. Implants can become infected. Those full arch reconstructions that we see, and we have to see them in our office, like sometimes fail, right? And a lot of it has to do with the hygiene of the patient, the recall schedule. So, it's important to know that they're not just this magic bullet that you can sort of forget about. In dentistry, I use a lot of analogies, and so I kind of use the car analogy, right? And so you kind of just bought yourself a brand new Mercedes, right? But everyone has this expectation that, you still got to take it in for an oil change. It still needs maintenance, and it's kind of the same thing with the implants in your teeth, and a lot of times more so with the implants even compared to your natural teeth.
You guys place new implants.
Mm-hmm.
Does it ever happen that someone comes to you with an issue and that was not your patient, like from some previous office or maybe abroad or something?
Yeah, all the time. So I think we see it, from all over different situations. Again, the dental tourism kind of aspect of it is kind of a whole nother discussion, but we see it in the States too. And so as specialists, again, we see cases that have failed, right? We see cases where stuff has broken, and it makes it a lot harder to fix. But one of the areas we sort of do specialize in is trying to rescue some of these cases. Just last week we saw a patient from an unnamed, full arch center, right? They claim to be that's all they do, full arch this, full arch that. And they just kind of told her that they didn't really know what else to tell her, right? She was still in pain. She didn't like how it looked. And they just kind of stopped wanting to treat her, essentially. Mm. And so she was doing some research, found us, and, luckily we were able to help her. But this did involve deconstructing, the old prosthesis. We had to remove a couple implants. We had to put a couple new implants in, design and print and give her a new temporary smile. I think she's coming in about a couple weeks so we can kind of do the final. But we see it more than you think, and we see it more than it's sort of advertised that there are problems with these prostheses that, need a specialist attention, outside of just, yes, I know how to place implants, but the real question is, do I know how to fix broken implants or failed implants? And that's a lot more complicated than just placing them in a new patient.
How does it work if someone comes with something that you don't work on usually?
Yeah, it's hard sometimes. I mean, so AI is very helpful, but a lot of times the first step is kind of identifying what implants they have. For the most part, all implants are titanium, some zirconium, but mostly titanium implants. But nowadays, there's hundreds of implant companies. So there's implants that have different types of threads, different designs, different surface materials. Every company always thinks that they're the best thing since sliced bread, is saying, oh, our implant is better because it has this. Our implant is better because it has that. And they've all got their pros and cons. We probably have, 10 to 12 implant systems that we use in the office for different reasons. Some are more aggressive for softer bone or immediate implant cases. Some come in longer lengths, right? If we're doing some more remote anchorage type of implants in different areas. Some we like in aesthetic regions better than others. They come in different sizes, but it's hard when we don't know. Some offices, if you had a decent office, will give you what's called like an implant passport, which is sort of like a little sheet that has all the implant information on it. If they don't have that, or they don't know where they went, or there's no way to get that information, a lot of times we rely on AI now, or just sort of knowledge. So we can sort of look at an x-ray and, within a relative degree of certainty, guess. And as funny as it is, there's some dental Facebook groups that we're a part of, and the most common post in a dental Facebook group is, what implant is this? Right? It's, hey, I've got this patient, I don't know what it is. And I mean, I bet you there's 30 to 40 of them a day of people posting x-rays saying, hey, I saw this patient, something broke. They don't know where they placed it. They don't know what implant it is. Can anyone help identify it? And so then, you get a collective effort of, 100 of dentists saying, oh, I think it's this one. I think it's this one. There's some degree of cross compatibility with some of the implants. So, as long as you roughly know, you can get parts. So It's not that hard. But it is challenging sometimes if you really have no idea what the implant is.
So it's also very important what provider you choose, and if you like this provider, just stay with them, right? Because they know what they're doing and they know what they're using.
And as a surgeon, I try not to second guess because, again, I wasn't there the day of surgery. We don't know what the thoughts or the rationale of why something happened, why something failed. The bad joke in residency is everything I did in residency is a geographic success because you're done in 3 years and then you kind of move away. So, most things don't have time to fail by the time while you're still in residency. Right. So, it's a bad joke, but the idea is, you really want to find someone that you trust and that can kind of handle everything. Unique to our office too is, not only do we place the dental implants, right? We also have the ability to do the 3D printing and design the temporaries. We also can restore the finals, and we also do our own maintenance. So meaning that, we'll see our patients once a year. We'll take off the prosthesis. We've got a special airflow device that is uniquely suited to cleaning around implants, cleaning around the prosthesis. A lot of these full arch centers, they don't do any of that. They just say, hey, here's your surgery. You're good for a week. Cool. Now go find a dentist and someone to take care of it.
And not every dental office is equipped and tools to clean.
Correct. Right. Yeah. They don't know what to do it. And so you really want to find, an all-encompassing office that can handle everything from start to finish, as well as the maintenance, right? And, it's a dumb analogy, right? But you would never, go buy a car from a place that says, okay, great, here's your car, but if you have any problems with it, sorry, we don't know how to help you, right? It's like, it's silly. You wouldn't go anywhere for that. But a lot of these full arch centers or dental offices, are okay with doing the surgery, but then don't want to deal with the responsibility of the maintenance and all the other things that go with it. Part of it's a business thing. It takes a lot of time, it takes a lot of effort, and these offices would rather make more money than really kind of care for the patients. Gotcha. And so, uniquely here is we've really kind of pride ourselves on being a one-stop shop for these patients where, yes, we can do the surgery, but we can print the teeth, we can design the teeth, we can give you the final, and we can help you take care of it long-term. So you don't have to go find other providers, to do all these individual procedures for.
Awesome. What's your favorite part of this job?
I think, everyone's answer is, it's silly, but it's, seeing the smile at the end, right? Which it's cliche in a sense because, of course, every dentist wants to make their patients smile. But I mean, the end of it is really where it matters and where you kind of say, okay, this is why I like my job. There are definitely days, after a stressful surgery, I may get home at 8 or 9 o'clock. And I question, why am I doing this to myself every day, right? Like, why did I miss bedtime with my daughter? Why did I not get to see my wife before bed? All to, do this kind of stuff and stress my life out. But it really all kind of comes full circle, once you see that patient, right? Once you we're able to help that patient. So again, going back to that patient, right? Like this patient came to us, was extremely upset, extremely depressed. She was in all of this pain, all this discomfort, and she had already gone to a provider, right? She had already paid all this money, gone through the surgery, and thought, hey, look, I'm done. I don't have to deal with this anymore. And they kind of just abandoned her, right? So being able to help those kind of patients really feel comfortable, kind of regain their self-worth too, right? Because these people kind of feel discarded, right? They're just like, these people that saying they can't help me, like, I don't know where to go. I don't know who to turn to. So those kind of situations where we're able to really kind of help remedy them and sort of give them their life back really is kind of what makes you okay with the other stress and all the other stuff that, you go through in a day. And, as cliche it is, I mean, that's where, that's kind of what makes it worth it, is seeing the end result, really seeing, after all these patients have gone through the surgery and the healing and all the other kind of stuff, getting that kind of last picture. And, Dr. G and myself too, we always try to record just like little funny videos with the patients at the end, take photos with them, really just to get their genuine emotion after being done with this whole process. My bad joke to patients is, hey, look, I may not be your best friend, for the next 2 weeks, but hopefully, by the end of the year, then you start to like me again. And so it's always kind of funny to get that on video.
So there are hugs.
Lots of hugs, lots of tears. We've got some patients we even just come in every once in a while to say hi. I mean, I can't tell you how many people come and just drop us off donuts and stuff because they were in the area. And, you really got to get to develop a relationship with these people and, really change their life for the better in ways that, yes, in our head, it's, oh, I'm just doing some dentistry, but, they live in a community, right? They have kids, they have friends, they have family, right? They can go out to eat dinner, and you sort of change their life in a way that you don't really realize at the time necessarily for every patient, and just all the way that, that kind of manifests for them. So, it's a cool part of the job.
Yeah, and I even saw one patient taking a selfie with you. So it is kind of like you being a superstar.
Yeah, they like us a little bit at the end, I hope.
So let's grow teeth in a lab. Is it a thing right now? Like, it's going around.
I don't think it's a thing yet, but it's sort of where medicine is trending, right? Just in the way that, they're trying to grow, artificial heart valves or limbs or stuff like that. I mean, there's studies where they've literally, they take little mice and are trying to grow, different organs in the mice and this, that, and the other. So, maybe one day it will be a thing. I know Japan has a lot of sort of the cutting edge research of at least trying to regenerate like the dental nerve. So as opposed to needing a root canal where the nerve dies, you're able to sort of put in stem cells and have that nerve regenerate, right? And kind of repair the tooth a little bit. So, it may be, our job may become obsolete one day, right? If implants are no longer needed, if we're able just to, grow a new tooth. I think it's going to be a long, long time before that's, clinically relevant for most patients. But, who knows? Maybe in 100 years, we won't need implants anymore and, we'll be able to grow teeth.
And until then, we have doctors.
That's what we're here for.
Thank you so much.
Yeah, thank you guys.